Hello everyone. Today, we're going to talk about a very important topic: how to be mindful of our mental health and take steps to prevent falling into depression. It's crucial to recognize that while life has its ups and downs, there are ways to manage stress and maintain our well-being. Firstly, it's essential to understand that depression is more than just feeling sad. It's a complex condition that can affect anyone, and it's important to seek professional help if you're struggling. However, there are also everyday actions we can take to support our mental health. Stay connected, reach out to friends and family. Social support is vital for our mental health. Keep active. Regular exercise can boost your mood and increase energy levels. Eat healthily. A balanced diet can have a positive impact on your mood and energy. Get enough sleep. Quality sleep is crucial for emotional and physical well-being. Practice mindfulness. Techniques like meditation can help you stay grounded and calm. Set realistic goals. Achieving small goals can give you a sense of accomplishment. Limit alcohol and avoid drugs. These substances can worsen depression symptoms. Remember, it's okay to not be okay. Taking care of your mental health is just as important as taking care of your physical health. If you're feeling overwhelmed, please reach out for help. There are resources and people who care about you and want to support you. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health awareness. Let's delve deeper into the factors and symptoms of depression for a clearer understanding. Depressed mood. This isn't just a transient feeling of sadness. It's a pervasive low mood that persists throughout the day, nearly every day, often described as feeling sad, empty, or hopeless. Loss of interest or pleasure. Known as anhedonia, this is a significant reduction in interest or pleasure in all or most activities that were once enjoyable, lasting most of the day, nearly every day. Changes in appetite or weight. Unintended weight loss or gain, or a decrease or increase in appetite, can be indicators of depression. Sleep disturbances. This includes both insomnia, difficulty falling or staying asleep, and hypersomnia, sleeping too much, affecting the individual nearly every day. Psychomotor agitation or retardation. Observable by others, this can be restlessness or slowed movements and speech. Fatigue or loss of energy. Feeling tired nearly every day, even without physical exertion, and a lack of energy to perform daily tasks. Feelings of worthlessness or excessive guilt. Disproportionate guilt or feelings of worthlessness, often about things that wouldn't normally cause such feelings. Difficulty concentrating. This includes trouble with focusing, making decisions, or remembering things, occurring nearly every day. Recurrent thoughts of death or suicide. Frequent thoughts about death, suicidal ideation without a specific plan, or a suicide attempt or specific plan for committing suicide. It's important to recognize that these symptoms can manifest differently in each individual, and that experiencing one or more of these symptoms doesn't necessarily mean someone has depression. However, if these symptoms are persistent and affect one's ability to function in daily life, it's crucial to seek professional help. Depression is a treatable condition, and there are various effective therapies and medications available. If you're experiencing symptoms of depression, it's important to take steps to address them. Here are some actions you can consider. Seek professional help. Consult a healthcare provider or a mental health professional to discuss your symptoms and explore treatment options. Talk about your feelings. Share your thoughts and feelings with someone you trust. This could be a friend, family member, or a mental health professional. Stay connected. Try to maintain social connections and engage in social activities, even if it's just a phone call or meeting someone for a meal. Be active. Physical activity can improve mood and reduce symptoms of depression. Consider taking up exercise or going for regular walks. Manage stress. Find stress reduction techniques that work for you, such as meditation, deep breathing exercises, or yoga. Healthy lifestyle choices. Ensure you're getting enough sleep, eating a balanced diet, and avoiding alcohol and drugs. Do things you enjoy. Engage in hobbies or activities that bring you joy and fulfillment. Set realistic goals. Set small, achievable goals for yourself to help build confidence and a sense of accomplishment. Remember, seeking help is a sign of strength, not weakness. It's important to address depression early on to prevent it from worsening. If you're in crisis or feel like you may harm yourself, seek immediate help from a crisis line or emergency services. Your well-being is the top priority. Choosing the right mental health professional to treat depression is a crucial step in your journey to recovery. Here are some tips to help you make an informed decision. Identify your needs. Consider what you're looking for in a therapist. Do you prefer someone who is more directive or someone who listens without much guidance? Are you looking for medication management, psychotherapy, or both? Check credentials. Ensure the professional is licensed to practice in your area. Look for credentials such as MD, psychiatrist, PhD/PsyD, psychologist, LCSW, licensed clinical social worker, or LPC, licensed professional counselor. Specialization. Some therapists specialize in treating depression and may have additional training or certification in cognitive behavioral therapy or other evidence-based treatments for depression. Ask for referrals. You can ask your primary care doctor, friends, or family members for recommendations. Local mental health organizations or support groups can also be a good resource. Interview potential therapists. Don't hesitate to contact potential therapists to ask about their approach to treatment, their experience with depression, and whether they have a particular focus or philosophy. Consider logistics. Think about location, session times, and whether the therapist's office hours fit your schedule. Also, consider if you prefer in-person sessions or if you're open to teletherapy. Insurance and cost. Check if the therapist accepts your insurance or if they offer a sliding scale fee based on income. Trust your gut. After meeting with a therapist, reflect on how you felt during the session. Did you feel understood and comfortable? It's important that you feel a sense of trust and connection. Give it time. Building a therapeutic relationship takes time. It's okay if you don't feel an immediate connection, but if after a few sessions you don't feel it's a good fit, it's perfectly fine to look for another therapist. Remember, the right therapist for you is someone you feel comfortable with and who you believe can help you make progress. It's worth taking the time to find someone who meets your needs and with whom you feel a therapeutic alliance. If you need further assistance, reputable sources like the Mayo Clinic, Harvard Health, the American Psychological Association, and the Anxiety and Depression Association of America offer additional guidance on finding the right mental health provider. Supporting someone with depression involves empathy, patience, and understanding. Here are some ways you can offer support. Listen without judgment. Be a compassionate listener and allow them to share their feelings without offering solutions or judgment. Encourage professional help. Gently encourage them to seek help from a mental health professional and offer to help them find one or go with them to the first appointment. Offer practical help. Depression can make even simple tasks feel overwhelming. Offer to help with everyday tasks like grocery shopping or household chores. Stay connected. Keep in touch regularly through calls, texts, or visits. Just knowing someone is there can be a great comfort. Plan activities. Suggest activities you can do together, but be understanding if they're not always up to it. Gentle encouragement can be helpful. Educate yourself. Learn about depression to better understand what they're going through and how you can support them. Be patient. Recovery from depression can take time. Show patience and understanding as they work through their treatment. Take care of yourself. Supporting someone with depression can be emotionally taxing, so make sure to take care of your own mental health as well. Remember, your support can make a significant difference in their journey to recovery, but it's also important to recognize the limits of what you can do. Encouraging them to seek professional help is one of the best ways to support them. If you're looking for more detailed guidance, resources like Psych Central, Mayo Clinic, and HelpGuide.org offer comprehensive advice on supporting someone with depression. When talking to someone with depression, it's important to communicate with empathy and understanding. Here are some things you should avoid saying. Everyone goes through this. This can minimize their experience and suggest that their feelings are not significant. Just cheer up. Depression is a complex condition that cannot be resolved by simply deciding to be happy. You just need a drink. Using alcohol as a coping mechanism can lead to more problems and isn't a solution for depression. It's all in your head. While depression does involve brain chemistry, it's not something that can be overcome by willpower alone. Look on the bright side. While well-intentioned, this can feel dismissive of the real pain they're experiencing. I know exactly how you feel. Each person's experience with depression is unique, and assuming you understand completely can feel presumptuous. You have so much to be happy about. Depression can affect anyone, regardless of their circumstances. Just snap out of it. If overcoming depression were that simple, no one would suffer from it. Instead, offer support, listen without judgment, and encourage them to seek professional help. Your role is to provide a supportive environment that acknowledges their feelings and offers compassion. If you're looking for more detailed guidance, resources like Psych Central and Verywell Mind offer comprehensive advice on supporting someone with depression. Recognizing signs of depression in someone else is crucial for providing support and potentially guiding them towards seeking professional help. Here are some common signs to look out for. Persistent sadness or low mood. They may seem consistently sad, tearful, or display a general lack of emotion. Loss of interest or pleasure, a noticeable disinterest in activities they once enjoyed. Irritability or frustration. They may be unusually irritable or have a short temper over minor issues. Changes in appetite, significant weight loss or gain due to a decrease or increase in appetite. Fatigue or loss of energy, feeling tired all the time or complaining about feeling physically drained. Difficulty concentrating, trouble focusing on tasks or making decisions. Feelings of worthlessness or excessive guilt, expressing feelings of self-blame or criticizing oneself over minor faults. Thoughts of death or suicide, talking about death, suicidal thoughts, or self-harm. Withdrawal, avoiding social interactions, neglecting personal relationships, and preferring to be alone. Neglecting responsibilities, difficulty in completing tasks at work, school, or home. It's important to approach the person with care and sensitivity if you notice these signs. Encourage them to talk about their feelings and seek professional help if necessary. Remember, these signs can vary in intensity, and it's not always easy to determine if someone is depressed based on observation alone. If you're concerned about someone, the best approach is to express your concern and suggest they speak with a healthcare provider for a proper assessment and support. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health awareness.